Today, I am really thankful to be introducing Professor Frank Frizelle, one of Bowel Cancer New Zealand's medical advisors and an esteemed colorectal surgeon. So thank you, Professor Frizelle, for coming in and spending some time with us.
Well, thank you very much for asking me to. Please.
One of the things that we come across a lot is that people aren't often aware of the symptoms that they need to be looking for. So what I'm wondering, Professor Frizelle, is if you could run through some of the common and maybe some of the not quite so common symptoms that people might show up with that would point to bowel cancer.
Sure. Thanks very much. That's a very important question. There's two broad symptoms that are common. One of them is a rectal bleeding. This is particularly so in young people. Bowel cancer itself causes bleeding. Now, most of the time, you may see it, and people inevitably blame their hemorrhoids, thinking it's that problem. In younger people, bowel cancer is more common on the left side, which means it's near your rectum, and therefore they present often early the very similar symptoms to hemorrhoids. Other parts of your bowel can bleed, such as on the right side from a cancer, but you don't often see it. So it usually means it's on the left side, which is close to your anus, which is, you can actually see the blood. The blood may be on the bowel motion, maybe mixed with the bowel motion, but sometimes, as I said, you can't see it, but you can test for it. And that's what the bowel cancer screening test looks for, what we call a cult blood. So bleeding is not normal. If you are bleeding from your bowels and it's persistent, you need to see someone and see what's going on. The other broad category is what we talk about as a change in bowel habit. Now, most of us don't have the same bowel habit every day. It comes and goes, varies just like life. And so what we're talking about is a persistent change, where the consistency or the frequency of defecation alters. So this might mean that you get what you think is a bout of diarrhea, then it goes away. You get another bout of diarrhea, it goes away. Then you get another bout. Really, if you've got past two, you need to do something about it. The change in consistency may be that you're used to hard poos, hard stool, and what you get is a looseness in the stool particularly. And so when you go, there's more mucus or slime, or just not held together properly. That's also a sign. The other features that are less common are the feeling of incomplete emptying, where people may go to the toilet, feel that they've had a bowel motion, get up, go, and then half an hour later back doing it again, or feeling that they can't quite empty out properly, that there's still something there. So that is a feeling of incomplete emptying, of tenesmus, that is a concern. There can be other features such as weight loss, fatigue, not feeling quite right, non-specific abdominal bloating and distension. Abdominal pain is an uncommon feature, except for an advanced disease or an acute presentation. So pain though it can be bowel cancer, it's not a common feature for bowel cancer, unless you've got something acute evolving. About 25% of people present with an acute presentation. It means they thought they were well yesterday and they're not today. And so, but with the development of screening and with increasing awareness of symptoms, more and more people are turning up before they turn up acutely, and that's helping. Younger people are more likely to turn up as an acute admission, and that's partly due to perhaps not realising the symptoms are significant, and also partly due to the system being set up really for older people who have symptoms. So younger people are often, that their significance of their symptoms not always appreciated by the people seeing them. So if you have persisting symptoms and you don't feel you've been listened to, ask for a second opinion or go and see someone else.